So this is upside down. Remember that everything that's up here in the body is always on the bottom. Plus it's the posterior view. That's why we flipped it upside down.
Oh.
The large size lobe, right lobe of the liver. The smaller size, left lobe of the liver. The one that's generally on the bottom has 4 sides to it, quadrate lobe of the liver. There's the gallbladder. Coming off the gallbladder, that duct, cystic duct. Coming out of the liver, that duct, hepatic duct. Hepatic duct and cystic duct combine and form common bile duct. Spleen. That's all I do on this. We do a separate stomach specimen, so I don't do stomach on this. Here's the duodenum. Here's a piece of that pancreas. Somebody asked me, where's the pancreas on this thing before? There it is. Now, why is it right there? Because it occurs in that piece of the duodenum that makes that letter C, right? It makes a beautiful pocket for it. What's right coming down in the center of that? The pancreatic duct, which joins the common bile duct. In my class, you got a quiz on that. Common bile duct joins the pancreatic duct, becomes a hepatopancreatic duct, and actually enters into, look at that, there it is, going into the duodenum at the ampulla of Veda. That's how all of those digestive juices get into the duodenum. I don't test on any of that here, but your professors might, so check with them if they want that. We'll move down. We don't use this on the test. Nobody does. I know that for a fact because it doesn't even get put out there. So our next one down here is the tongue. Basically, you've got 3 papilla that you need to know about here. The papilla that are oriented into that V pattern, circumvallate, they are big enough for me or anybody to stick a pin in one of them. That's easy. But the other 2 papilla that are in the anterior 2/3 of the tongue, they are the filiform and the fungiform. Those are the only 2 you need to know about. There is another one, but we don't cover them in this course. The fungiform are the ones that have taste buds. The filiform don't. You can actually see them. They are a little bit bigger, but for me to stick a pin in that thing and for you to be sure that's what I want is impossible. So we direct you with our question. If I stick a pin here and the question is worded in this manner, and I know the other professors, most of the other professors do this also. What is the name of the structure in this region of this organ that do have taste buds? The ones that do are fungiform. The ones that don't are filiform. That's what you have to remember. Filiform here, no taste buds. Fungiform here have taste buds. Circumvallate also have taste buds, but you can see them, so you don't even need to know that. Some of your classes will do this one here, the epiglottis. They might use this specimen here. That's why this has a pin in it. That is the epiglottis. These are real, by the way. So is this one. You can see the epiglottis on that. And you can see the tongue specimen here. I don't know, they just don't show up quite as nicely. There's circumvallate. Filiform and fungiform are out in this area here. The one student that was asking before about the foliate, I don't cover them, so don't worry about them. I mean, this is kind of fun to look at, but this is way above the scope of this class. Why? These are the glands. That's the mandibular gland. There's the sublingual glands. Kind of cool, but that's not on your test. And so you all just went blank, right?
I remember.
It's just cool. It's just fun. That's your tongue.